This is the Erasing Shame podcast, Season 3. Honest talk for healthy living, growing, and thriving.
Welcome to the Erasing Shame podcast, Honest Talk for Healthy Living. My name is Eunice Lee, and I am your Season 1 host with DJ Chuang. And today we're going to be talking about something a little bit different from our typical conversations about shame. We're going to be talk about being seen. Seen is a offshoot of the Erasing Shame podcast, and we're talking about things as broad as Hollywood representation and as personal as postpartum depression and anxiety. So I'm very honored here to talk with licensed marriage and family therapist, Emily Schnitger. Hi, Emily.
Hi, Eunice.
So Emily is a licensed MFT, marriage and family therapist. She earned her master's degree in marriage and family therapy from Fuller Theological Seminary and is currently practicing at the Relate Therapy Center in Pasadena, California. She works primarily with adult individuals and couples. She's trained in perinatal mood and anxiety disorders and is passionate about maternal mental health and helping individuals struggling with depression. When she's not sitting in her therapy chair, you can find Emily adventuring with her husband and 2 boys. Thank you so much for coming on this podcast today, Emily.
Yeah, thanks. I'm doing well. Thanks for having me. I'm really glad to be here.
Awesome. Yeah, so as you know, a lot of this podcast is surrounded by this idea of shame. And we kind of borrow from Brene Brown's definition of shame, which is that guilt is something that you do wrong, and shame is that you are wrong. And I want to start this episode today with talking about how this podcast is going to be informative about postpartum and prepartum anxiety and depression, but is not intended as a substitute for clinical treatment or professional therapy. So if you're experiencing a life-threatening emergency and you have serious thoughts of hurting yourself or your baby, seek help immediately and call 911 or go to your nearest emergency room. But we are excited to have a professional come and talk about postpartum and prepartum depression and anxiety. And so, Emily, as you and I were talking about this episode, I think something that came up is this concept that this isn't really talked about kind of overall in, majority culture, postpartum and prepartum depression and anxiety. And particularly in the Asian American community, there's not a lot of coverage of this topic. So I'm wondering, first of all, if you could maybe define postpartum depression and even how someone would know that they have postpartum depression.
Sure, absolutely. And yeah, it can be such a broad topic. I'm sure that we're just covering this in really broad strokes today, but it's not something that's talked about a lot. Or if it is, it's kind of dismissed or minimized and kind of viewed as like an exceptional type of scenario. But what people don't realize is that this is a little bit more common than we would initially think. That up to 1 in 7 or 1 in 5 women experience postpartum depression or other postpartum related disorders during this like very sensitive time. And so, it can be characterized by a number of different symptoms. And it's hard to identify it all the time, primarily because this is overlapping with some of the complexities of starting motherhood in general, that like you're just not getting sleep because baby needs you all the time. And there are so many different tasks and things that are expected of you. So much is demanded of you that you're worn thin anyways. And people talk a lot about the notion of the baby blues, that because of fluctuations in our hormones, we are just sometimes all over the place in that season of life with all of these adjustments that we're kind of getting used to. So postpartum depression, even postpartum anxiety can sometimes just look like regular motherhood and adjusting to regular motherhood. But they can be a bit more serious than just that. And so when you're getting the sense that something just doesn't feel right, or this is a little bit more distressing than you would expect, you may want to consider, am I dealing with depression here? Am I dealing with some anxiety here? And so some of the symptoms that you might be encountering, a lot of crying, a lot of feeling sad, changes in appetite, changes in sleep, which again, you're going to be experiencing those things anyways, but more than what you would expect. Feeling a lot of guilt or shame or hopelessness or despair, tapping into like a sense of feeling inadequate as a mom, and finding that you don't enjoy or find joy from the things that you used to. And I mean, even in this really special, precious time of like meeting your new baby and getting to know your new baby, finding that you have a lack of interest in that, having a hard time connecting with your baby or with your friends and family. And then even getting towards the more serious realm of finding that you're having thoughts of hurting yourself or hurting your baby. That's especially a time when you would want to reach out, seek out some care, let some people in, and find support.
Because it can get pretty dark. From what I know of postpartum depression, anxiety, it can be to the point where people want to hurt their baby or hurt themselves. And so before they do that, it's important to reach out and get help.
Yes, absolutely. And some of the things that we're talking about in this postpartum stage of the pregnancy and birth process, right? Some of the more common disorders of depression and anxiety, it's a little bit more or a little bit less common that you're going to be encountering women who are seriously considering harming their baby. Those are really more the exceptional cases of when you're dealing with psychosis, when you're finding a woman when you encounter a woman who's thinking of or talking about hearing voices, hearing thoughts who are telling her to harm her baby. And that's often actually what we hear about in the news. These cases that where a mom does follow through on hurting herself, hurting her baby. And that's often misdiagnosed in the news as postpartum depression, but it's actually something quite a bit more severe. But what is more common is a woman, finding a mom who is just scared that she's going to do something to hurt her baby, right? And that's where the anxiety comes in, even some more like OCD types of tendencies where the mom is scared that she's going to contaminate her baby in some way, that the baby's going to be exposed to something, or that she's so preoccupied with her own felt sense of inadequacy that she's worried she's not going to be able to take care of her baby well enough. And so it's more that fear of that, being afraid of hurting her baby. Does that distinction make sense?
Yeah.
Okay.
Yeah, I'm glad you made that distinction, because I think that when there's not a lot of education about postpartum, we immediately go to those stories in the news of
absolutely
share with your partner and with your family that you're struggling.
Yeah.
Yeah, I like that. I like that distinction. I find in the Asian American community, a few things stick out, which is that we tend to minimize our emotions like depression and anxiety. So especially when a mom is struggling, those emotions aren't really taken seriously, like the anxiety and the depression. And then also overall, I would say, I don't want to make a huge generalization, but I'd say that there's pretty strict gender roles. We're pretty conservative. We tend to be, the dad's role is this and the mom's role is this. And so I can imagine, or I know from personal experience, that going into a new role of being a mom, it means so much more than, say, somebody that has a progressive background where it's just a shift in life transition. This is like a new identity that we take on. And I'm wondering if you see that with those are contributing factors to postpartum.
Yeah, absolutely. I think a lot of moms have this notion that, one, they're just supposed to love this whole process, that it's just supposed to be the happiest time in their life. And that's, based on societal expectations, even maybe just your own internal expectations of what you thought this was going to be. And that may not be at every situation, but I think in many cases, moms just expect or assume like this is going to be good. It may be hard, but and so I encounter a lot of moms who put this expectation, maybe whether it's they put it on themselves or they feel this from the people around them, that they, in order to be a strong mom, in order to be a good mom, you're going to be doing it all. You're going to be managing it all. You are going to be taking care of your baby, and it's going to come so naturally. It's going to be so, just intuitive, and that you're still going to be managing your home, and you're going to be putting dinner on the table, and you're going to be cleaning your house, or, whatever the expectation is of, this is what it means to be a woman. This is what it means to be a mom. And this preconceived notion that you're supposed to have all of what it takes within you to make that happen. I feel like that needs to be challenged, to say that this is a time when, a mom is giving so much of herself to her baby, that how could she not need other people pouring into her, whether that's her partner, whether that's the extended family, her friends, her community around her. Sometimes strong means having the ability to ask for help and accept help from other people, instead of just assuming that you're supposed to do it on your own, supposed to be able to do it on your own.
I love that. I love that reframe that you just did, which is strong means asking for help and accepting help rather than feeling like you have to do everything on your own.
Right. Yeah. And like when we're talking about shame, and so much of shame manifests itself in silence, right? In what we don't say and what we don't share. And so to find the courage, to find the bravery within yourself, right? Those are good, strong words, courage and bravery. To put these things out there, that you're having a hard time, that you think you need help. That's strong. That's being a strong mom. That's doing your work to face shame and say, I don't need you here, to make this harder and lonelier for me.
That's amazing. I think that is what a lot of moms need and don't get, is that reality that they can't do it alone, and that's okay. And it takes a village. So
right.
I love that you said that.
Yeah.
So I'm curious, what are some misconceptions about postpartum anxiety and depression? You touched on some of them, but I'm curious if there's any big ones.
Yeah. I think one of the common misconceptions is that in the midst of like not really totally understanding what's going on within yourself, of like feeling like something feels off, something feels wrong, and you may be like taking some of those like brave, courageous risks to like drop a hint with someone, like put something out there, put some feelers out there of like, I haven't been, I haven't been feeling as happy as I thought I would feel in the midst of this. I think women do slowly try to put those things out there and get a sense of how are people responding to this. And one of the most, unfortunately, sometimes the most problematic places is they'll do this with their doctors, and they'll bring this up with their OB, at their follow-up appointments. And when your doctor hasn't received, as thorough of training as you might expect in a mental health background, they may be quick to just kind of minimize and say, you're just experiencing the baby blues. This is normal. It'll go away. You just need to get more sleep, which is always true. You always need to get more sleep. Yes. But to not really take those things seriously, to not really stop and listen and say, what is going on? To not even, there are, I want to say more and more, but I don't know if this is actually true. There are some doctors who will do screenings for postpartum depression, specifically to have you answer questionnaires and just see where you're landing, where you're rating yourself, and to keep an eye on that. But unfortunately, not all doctors are keeping an eye on that. And so, knowing that it's, so important that you be able to seek out medical professionals, mental health professionals, who have had training, who have, whether it's training, or just have expertise in this area of mental health specifically, who can understand what are some of the considerations that we need to make, what are the things that we need to be looking for, when is it appropriate to maybe consider medication, if at all, and when is it important and appropriate to refer out and to help, a woman, help a mom find and get connected with a mental health professional, someone who she can talk with and process through some of the things that are coming up. So that's a really big one. I think another misconception is just that, again, that notion of what we see on the news misrepresented as postpartum depression, right? These really severe cases. When we see that, we're really, or people can be inclined to dismiss and minimize what they're going through of like, well, it's not that bad. And so they're less inclined to just seek out help for themselves and say, actually, what I am going through is still hard. It's still hard. And if I do this, if I keep doing this on my own, it could really just get harder for me. And instead of, just telling yourself to suck it up and push through it or pray harder, have more faith that God will do it. Even the notion, I've heard some people say, you're just not choosing to be happier. This is really a choice. And it's not. This isn't something you can just will for yourself. It takes time and it takes help. It requires support.
Yeah. So what do you find that women wish their partners would understand about postpartum depression?
Well, I think a lot of these things, of knowing that they're not choosing this. Even just to speak to, the experience of a partner, like they're going through their own process of adjustment to parenthood and, the same kind of sleepless nights and just constant caring for a baby. Although again, depending on the family, that might look different based on whether it's gender roles or, how they're dividing up that work. And so, it's going to be unique for each partner, but, for a partner who is seeing, this mom, their spouse, their significant other going through these kinds of changes in their mood, they're probably going to feel maybe kind of confused. They're going to maybe wonder, like, where did my partner go? Like, this feels like a different person. It can feel like a different person. And so it's really important for that partner to know that mom might be feeling exactly the same way. Where did I go? Who am I? Especially if this is, far outside of their normal experience. If this is really new to them. And so, it's really important for the partner to, if they are capable, right, of doing this, which sometimes partners can be experiencing these exact same types of symptoms themselves. In fact, I think the numbers are somewhere around like 1 in 10. And I don't know if this is specific to dads specifically or just partners in general. But 1 in 10 experience some of the same symptoms of, either postpartum depression, postpartum anxiety.
Wow. So 10%.
10%, which is a lot when you think about it. And so it's not uncommon. These are, it happens. It's not just you. It's not just you. It's not just your partner. And so, whether it's you, the partner, whether it's your partner, the mom, I think what everybody needs to know is that you all just need support. Whether that's in the form of, again, more community, more family around you coming in, whether that's meeting with a mental health professional who can be with you through these, through the hard stuff, process what's going on, finding ways of coping through it, finding strategies that are going to help you get back around to feeling like a new normal, because it is an adjustment to a new normal when you're at least when you're talking about like a first child in the home. But just, what is normal? After baby.
So what can help if you have a partner or a friend that has postpartum?
I think it's important to just start with creating space to listen. If we're talking about, let's say, the new mom who's experiencing some of these symptoms, make space to listen to her, believe her, and show her that you're safe. Do what you can to kind of regulate if things are coming up for you. Talk about that with somebody else, but approach this in as non-judgmental of a way as you can. These are scary thoughts sometimes that we're talking about. These are scary feelings that we're talking about. And it's really risky. It feels really risky to put it out there and vocalize those things. Find ways to be just as concrete as possible in the ways that you offer your help, whether it's a matter of like making a nutritious meal for the family, for your wife, for your partner, wash the dishes, fold and put away the laundry, all these little things that build up in the midst of like, just your whole life being thrown out of whack. And if you're not able to do those things, find ways that you can bring people into your life who can help you guys out with those things. I would encourage people to be cautious about offering advice, even though that's often well-intentioned. It can be experienced as, it really doesn't always just speak to the reality of the mom's situation. And so it can really lose sight of what she's feeling and what she's going through and minimize that. And so even if it worked for you, if you're another mom, even if it worked for you, it may not work for her. And so, again, listen to her, ask her what she needs, help her discern what she needs. But don't tell her what she needs. And it can be helpful too for partners or for friends, for family to help connect a mom with a good OB. Do your research to connect them with a good therapist, someone who has experience working with postpartum disorders, who's had training in it. Ask them what their experience is, ask them what their training is. Those things don't necessarily guarantee a competent mental health professional, but the hope is that it will be a good indication of,
I think I really like the two things that you're talking about with offering concrete help, like folding the laundry, creating a meal train. Because I noticed that when people, even when I was a new mom, people would say, "Let us know what you need," and that's really hard to cash in on those things. Like it's
absolutely.
Can you come and babysit for us, or can you bring us a meal? There's X amount of people in our family, and it feels like a burden. So the more concrete you can be with what you can offer, I think the better, especially when the mom is not sleeping well and going through things. And then the second thing is not offering advice, which is really hard sometimes as moms. We want to save people from the struggles that we had. And so offering advice can feel like we're helpful. But on the other side, it can also feel shaming. Like, oh, you didn't know that? Well, here's some advice. And I love that you brought that up, because it's really about attuning to the mom and figuring out what she needs and empowering her in a place where she feels kind of out of control. So I love that.
Absolutely. Like there's a big difference between telling, right? Like offering advice and then just collaborating, like collaborate with her, brainstorm together. The notion of feeling out of control, like, right? Like she's feeling like all of these things are happening to her potentially, and that it does feel so far out of her control. So to come back to a place of recognizing within herself, like, I do know me, right? And feeling a little bit more empowered, instead of just having, someone else come in and try to be the expert. That's perfect. I'm glad that you named that.
Yeah. And so my last question for you is, what would you say to somebody who, hopefully there's a listener out there that is experiencing postpartum and that this conversation has been illuminating. And so if you were to speak to her, what would you tell her? What would you say?
Yeah. I'd want to, one, reassure her that it will get better.
Mm-hmm.
It will get better. It won't always be like this. It's hard right now, in the midst of it. So much of this is, a process of just having massive fluctuations in hormones and trying to reorient in your body. And it's not just that, but that's a big component of it. And so with time, things will even out. But yeah, I guess in addition to that is just, you're doing one of the most important jobs that anyone can do ever, of bringing a child into this world, of creating this child, of being everything to this child. And it's such an important job. And so of course you need and deserve the care and support and services of other people. And it's okay to let those in. You don't, you shouldn't have to do this alone.
That's awesome. I love that, Emily. Thank you. So is there a way that if our listeners wanted to get more information about postpartum, or even come and see you as a professional, and you're out here in Pasadena, California, how can they reach you, or how can they learn more about this topic?
Yeah. Well, for me personally, I'm a part of a group practice called Relate Therapy Center. You can find me on our website. Our main website is relatetherapycenter.com. I can get you a direct link to my site as well. And if you're interested in information or getting connected with professionals in your area, one great resource is Postpartum Support International. They offer a lot of information on their website, but they also have provide services to connect you with local coordinators in your area to help you get connected with professionals who have trained in, received training in perinatal mood and anxiety disorders, and can help you find the support that you need. So that's a great resource. If you're not able to find people in your area, you can often, even just a search on Psychology Today and looking for people who work with pregnancy, postpartum, who specialize in that area. And sometimes it takes a little bit of research to connect with those people, to ask some of the hard questions of, what is your experience? How familiar are you with some of the complexities of this area? But often that can get you connected with just people who will, be a support, be of service.
Great. So those resources we'll put on our show notes so that our listeners can get a hold of you or get some more information about this. And I just wanted to thank you so much, Emily, for coming and just talking about this very important topic. And hopefully a listener out there will gain some knowledge, gain some insight, and also some courage and encouragement from what you shared today. So thank you so much.
Yeah, absolutely. Thanks for having me.
Thank you for being a part of Erasing Shame. Please rate and review on iTunes, subscribe on YouTube, and like on Facebook. Share with your friends and followers. Together, we are erasing shame one story at a time. Get all the details at erasingshame.com.